If you're like millions of other family caregivers, you want the best care for your aging loved one, but getting that care can be frustrating. You know what it's like to drive your loved one from appointment to appointment to manage all of their medications, and you struggle with leaving your loved one at home, alone and without the supervision, company, and stimulation they want and need. It doesn't have to be this way. Thousands of families across America have found a different and better kind of care for their aging loved ones. Catholic Health's program for all-inclusive care for the elderly is called LIFE, Living Independently for Elders, and is centered around the belief that it is better for the well-being of seniors with chronic care needs and their families to be served in their own home whenever possible. We think LIFE is a different and better kind of care for aging people. LIFE is an alternative to traditional nursing home care. We like to think of it as life at your own pace. Catholic Health Life serves individuals who are age 55 years old or older, Medicare and Medicaid eligible, or willing to pay privately, certified by New York State to need nursing home care, are able to live safely in the community at the time of enrollment, live in the Catholic Health Life service area, expected to need the long-term care services of the plan for at least 120 days, and need to agree to receive all services through LIFE. LIFE, a new approach in the treatment of frail elderly, allows individuals to remain in their own homes while receiving needed medical and support services in a community-based setting. The LIFE program at OLV will support up to 350 participants, offering a variety of services. Care and services are based on medical necessity and include transportation, adult daycare that offers nursing, physical, occupational, speech, and recreational therapies, meals, and nutritional counseling. Primary medical care provided by a LIFE physician familiar with the history, needs, and preferences of each participant. Home health care and personal care, all necessary medications. Social services, medical specialists such as audiology, dentistry, optometry, and podiatry. Respite care, hospital and nursing home care when necessary. What LIFE families experience is a program that provides and coordinates all the kinds of care your loved one needs, so you may not have to place them in a nursing home.
The LIFE program at OLV is very innovative, particularly for the Western New York area. We like to think of it as a better and a significantly different way to provide care for the frail elderly in the community. We provide all services, including home care and primary care and therapies, physical, occupational, and speech. We provide medications, we provide transportation. In essence, we just about cover all of the bases, both medically and socially, for this particular population.
At LIFE, a team works together to help take care of your loved one. This means they get to see all kinds of caring, qualified providers, doctors, nurses, social workers, and therapists who develop an individualized care plan that is right for them. This way, care revolves around you and your loved one.
Most individuals come to these programs 2 or 3 days a week and enjoy the socialization and the recreation and the activities here in the day center. And during that same period of time, we will also schedule them, if needed, to see their physician, who is also on site. We have a full primary care office situated at this location. It will be staffed by a primary care physician, nurse practitioner in all likelihood, and nursing staff and others. And any primary care needs that an individual may have will be addressed during those visits. If there's a need for any of the therapies to be brought in on a particular situation, we can also have physical and occupational therapy done right here at the center, so that again we try to provide as many services as possible at one location. When it comes to medical specialties, we've contracted with a number of physicians within the community who will be available for our specialty needs, such as neurology and gastroenterology, etc. So we have all of those in place as well.
You know your loved one better than anyone else. That's why LIFE keeps you and your family at the center of healthcare decisions. You and your loved one will feel confident, safe, and comfortable with the care and support you receive.
As a therapist that's worked in the traditional model for a number of years, clearly we always want to try to involve the family in the decision-making process. Sometimes that's limited at times by the traditional model of what we're allowed to do. We're sometimes more dictated by a set of rules that we have to then try to have that person's needs fit the rules that the insurance companies give us. Here, that's kind of different. That now the focus can truly be on working with the family, working with the individual on really setting up a treatment plan and actually being able to implement it in a way that meets the specific needs of the individual and the family. The type of program that the Catholic Health Life PACE program affords more choice as a clinician and being able to say, you know, they don't need this to stay in the home, but they might need a ramp, or they may need certain bars in the bathroom that traditional insurance or third-party payers really may not permit.
Life promotes greater independence for area seniors and is more cost-efficient than traditional nursing home care. This program will give family caregivers a new level of support to maintain a loved one's independence.
My enthusiasm for the LIFE program is based on its innovation and the options that it makes available to participants and their families. The most important option that I think the LIFE program is going to make available to participants and families is the possible opportunity to avoid a skilled nursing home placement, which for many families is a very difficult choice to make. Western New York is a very proud area with very deep roots, and I have seen in my own family that the choice to leave a family home of over 50 years can be extremely difficult. Many elders really want to remain in their homes as long as they possibly can do so.
For consumers, Life provides a professional team who listens to and can respond to their individualized care needs, the opportunity to continue living in the community as long as possible, the ease of accessing services all in one place. For healthcare providers, Life provides the ability to coordinate care for the individuals across settings and medical disciplines, and the ability to meet increasing consumer demands for individualized care and supportive services arrangements.
And most people, if they can, would much prefer to stay at home. This program affords that opportunity to do just that. We can support with home care if the need is there, to send aides in to help with dressing and feeding and etc. And by bringing individuals here to the day center, that can allow some respite time for the family so that they get the help that they need. And there's many times when family structures get stressed to a fairly high degree in trying to care for the frail elderly at home. We try to kind of plug the voids and help assist family members in continuing to support their loved ones at home, and simultaneously being able to tap into numbers of health professionals who can support them in that environment.
At Life, the goal is that cost will never be a barrier to receiving the care that is needed and will not vary based on your loved one's changing needs. If your loved one is covered by Medicare and Medicaid, there are never copays or deductibles. For those not covered by Medicare or Medicaid, there are private pay options. Also, as all services must be authorized by Life, payment by the participant may be required for non-authorized services. For those who pay for care, Life provides cost savings and predictable expenditures, a comprehensive service package emphasizing preventive care that is usually less expensive and more effective than acute care, a model of choice for older individuals focused on keeping them at home and out of institutional settings. As advocates for elder care, Life is just one step Catholic Health has taken in regards to initiatives that are focused on person-centered care. Life truly embodies the Catholic Health's vision of commitment to being a leader in the transformation of healthcare in Western New York. For information on Catholic Health's Life program, please call 716-819-5433.